All right. Can everybody hear me?
Yes, sir.
Good morning.
Morning.
How y'all doing today? All right. Thank you for the wonderful introduction by Dr. Trimmo there. As he said, my name is Nate Boutte. Yes, it is Boutte, like shake your Boutte. Okay? Get that out the way. Now, y'all never gonna forget my name. Like it was Dr. Boutte. And like I said, I am a pharmacist. I graduated pharmacy school back in '07, so I've been doing this for a little while. All right. So now I know y'all generation. We had a little music earlier. Do y'all know who the Dells are? Delphonics, Shy Lights. Okay, so yeah, that's my dad. My dad taught me on that. I'm more of a Boys to Men, a Mary J. Blige, that next little generation that came along. Okay, so I'm not as young as I look, and I say that because it's actually worked against me in the past when I've gotten up and tried to tell somebody about some medicine. Like, can you go back there and get the real doctor? Because you're too young to be here. Um, but we don't have a whole lot of time. And I like to talk and I want y'all to talk. So like y'all engaging with me right now, keep this up, but hold your questions until the very end. Okay. I'm gonna try to hang around a little bit after. I do have a flight to catch, but hold your questions to the end. We're gonna go through a couple of questions. Some of the answers y'all gonna like, some of the answers y'all not gonna like. So just be prepared. Okay. Um, Real quick, I want to say thank you to the Research Institute for having me come out here. I look around this room. I've never seen a room like this, and I talk in a lot of rooms, okay? Medicine and the clinical trials that happen is how the medicine gets to the people, okay? Remember everything, I remember COVID happened, right? That vaccine that came out. Who got a COVID vaccine? Raise your hand. Okay, so now with that COVID vaccine, we had very few people that looked like you and me go through the clinical trial to make sure it was safe. So when people came in and asked me, Doc, is it safe for me? I could tell them what I knew, which was what was in the clinical trial information. And the number of African American males in that clinical trial was very, very low. So I couldn't say a whole lot because y'all, like I said, some of the stuff y'all not gonna like. We, as African American men, typically do not like to go to the doctor, right? But from what I understand, this room of men is all about their health and their well-being, and that's why they're here. So what I'm gonna need y'all to do is be my ambassadors and get out there and preach this, okay? Because they say y'all the choir, okay? I'll be the pastor, y'all gonna be the choir, okay? All right. So as we move on, like Dr. Truman mentioned, I work for a pharmaceutical company. It's called Vive Healthcare. They're like the HIV branch of GSK. And the other thing is, I am a pharmacist. I've been a pharmacist since '07, licensed in 3 different states. I am not your pharmacist, though. Okay. So, like I said, some of these questions, y'all not gonna like my answers because it's gonna be like, well, that's not, I want you to give me an answer. If I had your medical information in front of me, if I had your past medical history, if I had all that information in front of me, then I could give you a better answer, but it still might not be the answer that you like. Okay. So I just want to put that out there as we go through some of these things. Now, Dr. Trimble just went through dementia and Alzheimer's in the umbrella, and I've looked at some of the past videos, so I know that y'all are very well educated on these topics. But who here has heard of old timers? Mm-hmm. Okay, all right. So, as Dr. Trimble has already pointed out, as you get a little older, things change, right? So, like I said, I'm a little bit older than I look. I hurt my leg and I couldn't go running for like 3 months, picked up some extra weight. That didn't happen when I was 25. So things like not being able to remember where your keys are, and as you get a little older, some of that stuff is to be expected. Some of that stuff is normal, right? As he mentioned, Alzheimer's is a medical condition, okay? And early diagnosis equals better prognosis, right? So it's very similar to cancer. Who here is familiar with cancer? I know we had some questions about cancer, right? So with cancer, the sooner you find out, the easier it is to treat, okay? And then in the Alzheimer's space, there's some very exciting new therapies, okay? Full disclosure, my mother, God rest her soul, she passed away from complications of Alzheimer's, okay? And as Dr. Trimble mentioned, when you can't function is when you kind of know, but you have signs before that, okay? We saw some of the signs before that, but it took some time for us as her kids to get it together and bring her on over to the doctor. And like I have a daughter who is now 12. She was 1 at that time. And my mom asked me a question. And then like 5 minutes later, she asked me the same question because my daughter had got her ears pierced. And she's like, I asked you that same question already, didn't I? And I said, yes, ma'am. And then she knew, and I knew, and that's when I got with my sisters. I was like, we're gonna have to get her on into the doctor. Got a lot of tests done and things like that. And she did live for several years after that, but it's one of those things where and but it's hard. It's hard to bring up that conversation, right? But we need to. Okay. So I'm asking y'all to not just do it with your families, but bring it to your friends and your friends' families too. Okay. All right. So as we move on, the last one I had on there is medicine causes confusion. So now this is just some confusion medications. Literally, that's what it is. Drugs with strong anticholinergic properties. We don't have to get into the whole muscarinic system and everything and the way that works. But you'll see all these medical names up here. I want to point out one to you here. That's diphenhydramine. Who's familiar with diphenhydramine? Got a couple people? Okay. That's Benadryl, y'all. Who here has taken Benadryl before? Yeah. It dries you out and it makes you sleepy, right? Some of these other medications that's on here, if we look to the far right, you got carisoprodol, cyclobenzaprine, tizanidine. Cyclobenzaprine, I know some of y'all in here that had cyclobenzaprine before, AKA Flexeril. Right, so these medications that can cause dryness, that can cause muscle weakness and things like that, they can cause you to feel a little tired, a little confused, and sometimes that can be confused with some of the signs and symptoms. That can be confused with some of the signs and symptoms of Alzheimer's, dementia, and things of that nature. So keep that in mind as you talk to somebody. So like if they have quote unquote old timers, check and see what kind of medications that they're taking. Now, is anybody in here a pharmacist or a medication expert? Got one. Okay, we have a pharmacist in the house. We got another one over here. So the rest of us, not pharmacists, not medication experts. So who should we go and try to find and talk to? Yes, you're a pharmacist, okay? So that's one of the big things that we always advocate for in the field of pharmacy is get to know your pharmacist, right? Now, I know y'all looking at me like, man, doc, that pharmacist, they on the phone, they busy, they doing this, they doing that. I ain't got time to talk to them. They ain't got time to talk to me, right? I promise you, they do. I know it does not seem like I used to work at literally the busiest Walgreens in the state of Tennessee. Okay, it was a 24-hour Walgreens. We filled probably 1,200 prescriptions a day. Yes, I spent a lot of time on the phone. Yes, I spent a lot of time checking the prescriptions. But people would come up to me and ask me questions. Sometimes it was like, just give me 2 minutes. 2 minutes. I go do some stuff, answer a few phone calls. I literally will come from behind the counter, walk over to whatever the medication was, talk to the patients about the medication, right? Also, if you have questions about the medications that you are taking, your doctor gave you a new medication. I don't trust it, doc. Like, he gave me the medication. I don't trust it. What you think, right? Now, I know y'all are not the generation that goes necessarily to Dr. Google. But I'm pretty sure that y'all got some people in y'all family that y'all trust, and they go and talk to Dr. Google. Okay, so I love Dr. Google. He's great, but he brings a lot of information, and a lot of times people will come and ask me if what they read on Dr. Google was accurate or not. And when I tell them no, then they want to pull it up. I'm like, no, right here it says. Why did you come and ask me? But so one of the things that I want to really empower you guys to do, to be advocates for yourself and being able to look up things, okay? There are sources that are out there that can be trusted. You think of places like the Mayo Clinic. I know the Mayo Clinic website has a lot of really good information that's freely available. You can go mayoclinic.com, type in information and go from there. I will say, especially nowadays with the Google, be careful, y'all. So I don't know how technologically savvy everybody is in the room, but who's here heard of AI? Okay, so if you go to Google now and you start typing in a question, the first little answer that pops up gonna have some little stars off to the left. And that is AI going through, pulling an answer from information that it has culled from the internet. So we didn't went from now, instead of just trying to pick a respectable website that you think might be accurate, to there's an answer that's popping up for you. And we don't know exactly where it got that information from. So just don't Google it. And then the first thing you see, go with that, okay? All right. Now, I know we don't have a ton of time, so I'm gonna keep it moving. So one of the questions that got submitted, thank y'all for doing the survey, submitting questions. When do you have to or request your med review to see if it's effective or even still necessary? Do we have any answers in the room? Does anybody know? Thoughts? Okay, now, who all went and talked to the pharmacy students? Raise your hand. Okay. Yes, sir, right here in the green shirt. I'm calling on you. What's your name? McClellan. All right. Mr. McClellan, how was that experience for you? What did you do? Okay, so for those of you who couldn't hear Mr. McClellan, what he said was it was a good experience. She went through the list of medications. She asked me, did I know why I was taking them and what they were used for? That is it. That is what we call a medication review. We used to call it back in my day, the brown bag, which is where we would tell people like, hey, get your brown bag, dump all the medication bottles you got in there and bring it on out. And I would sit there and pull up the bottles and look and be like, hey, you got this one from Kroger, this one from Walgreens, this one from CVS. And it's like, okay, this one is a hydrochloric. Like, when's the last time you took this one? I don't know, baby. Like, okay, so that is what we used to do. And actually, this has been, so I'm getting old now. It's been about 20 years, but they actually have a technical term for it now. It's called medication therapy management, also known as MTM. And that's what I have up here on the slide, okay? Now, MTM is just the fancy way of saying what Mr. McClellan just did. So that's what those pharmacy students just did. This is one of the few times where the practice of medicine and the business of medicine dovetail nicely together, okay? So a lot of times there are things that I'm not able to do due to the bottom line being money. And my pharmacy students, they're coming in now. Because you learn, like, you know, the best treatment, the best medication, so on and so forth in pharmacy school, and you go out thinking that's what you're gonna do, and then you get in the real world, and it's actually it's the best medication that the patient's insurance will pay for. Okay, and then you're like, but this, no. This is what the insurance will pay for. This is what they're gonna get, okay? But with this medication therapy management, right? So everybody in here qualifies for Med D, right? Medicare Part D. Yes, okay, all right. Also, open enrollment is coming up. I believe it's October 15th through December 7th. Yes, okay. Everybody familiar with open enrollment? All right. So who's gonna have the open enrollment done before Thanksgiving? Gonna have open enrollment done before Thanksgiving. Come on. All right. Y'all, it's so important because y'all know once we're retired, we're working with usually a fixed income. So we don't want our medications in September to be, $45 for all three of them. And then October for it to be $355 because of the donut hole where the insurance causes the medication to go up. So you can help avoid some of those things by taking that time now, figuring out which plan is going to be best for you based on the medications that you're taking and see what that's going to look like, okay? So back to what I was saying about the medication therapy management. Medicare actually pays for you once a year to get what is known as a CMR, okay? That is a complete medication review. That is basically what y'all just had. Only difference is they do it on the computer with the pharmacist, they submit that information. And this is what the beauty of it is. The pharmacist wants you to come in and do this. They want to see which medications that you're taking and see, are some of them duplicates? Are some of them at wrong doses? Do you have a disease state where everybody should be on this one particular medication and you are not? The insurance company wants you to do this too. So like I said, I'm a little bit older. Like, has anyone heard the phrase, an ounce of prevention is worth a, see y'all, all right. Y'all my people. Okay, so like I'm always teaching these type of phrases to my young folks, but yes, that's exactly it. Okay, an ounce of prevention is worth a pound of cure. So that's what MTM is essentially doing. You go through, you look at those medications, you see medications that people should be on that they're not, and you also see medications that they have that they don't need, right? So for an insurance company, if we can take away 3 medications, for me as a pharmacist, I'm happy because that's less medications for my patients to remember to take. As a patient, you happy because that's less medicine for you to take and for you to buy. And for the insurance company, oh, this is great. You know, we don't have to pay that other half because y'all medications ain't cheap. They are not cheap. So that is one of the reasons why you need to go to the pharmacy and let them know you want to do it. Okay, they're gonna have to set it up because it takes a little time for them to do it properly. It may take 15, 20, even 30 minutes, depending on how many medications you got. Okay, so like I know I'm putting on my time. Are we good? We good? Okay. All right. I'm just making sure because I will talk all day. Y'all had some really good questions. So I'm gonna go ahead and move into some of those questions. But everybody want to make sure we understand the pharmacy, the insurance company, everybody wants you to go in and get MTM. Okay. If you walk in and just say, he said somebody MTM, like they gonna know what I'm talking about. Okay. And they will be like, yes, we want to do MTM because it pays the pharmacy. And most of those pharmacists are so busy because their people that's over them need them to do these type of things to bring in additional funding for pharmacists. Okay. All right. As we move along. Okay. So some of the questions that came in. All right. Since I told y'all might not like some of these answers. What is the safest medication for overactive bladder that would not affect thyroid medication? I do not know. This is what I'm talking about, y'all, okay? You can't just randomly ask me a question about thyroid and this and that and so on and so forth because I don't have all of the tools and I don't have all the information that I need to be able to successfully and accurately answer that question. I don't know, how overactive your bladder is. I don't know if you've actually been diagnosed with an overactive bladder. I don't know if you're taking some type of supplement for your overactive bladder. I don't know which thyroid medication you're taking. There's a lot of thyroid medications out there. So I can't truly give an answer to this without more information. Well, you can, okay? You can go to your pharmacist. Your pharmacist can look you up and be like, okay, yeah, you on this one, you on that one, et cetera, et cetera. And the term safest, that's a broad term, right? So safe as far as like, well, less side effects. Safe as far as it's more effective or less effective. So there's different medications out there. There are newer medications. There are older medications. There are over-the-counter medications. There's little stuff you see on the infomercials on TV when you watch the basketball game. So it's a broad question, but that's one that when you go to your pharmacist, they can start you on the right path because they can see which one you own, which thyroid you got, and go from there. Because if you're asking this question, what is the safest medication for overactive bladder? I'm betting that you're taking a medication and maybe you're having some type of side effects or you're having some other things that's going on and you're concerned. That is good, okay? The best advocate for you as a patient is you. Nobody knows yourself and your body better than you do. I'm a pharmacist. I would literally see 100 people in a day, talk to them, this, that, boom, 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 boom. Next person, right? Most of my clinicians, most of my primary care docs, they have a limit of 15 minutes they can spend with their patients. So if you know something's going on and they don't have time to actually spend with you to figure out exactly what it is, be the squeaky wheel. Keep coming back. Go to another doctor. Go to a friend. Go find out because you know what's going on. Okay. How many different drugs can you take at one time? I will say this. My personal record as a pharmacist was I had a lady that was on 27 different medications. Yes, she literally had 3 big bags. She had insulin. She had like 3 or 4 blood pressure. And it was one of those where for my pharmacy students over there, when you try to do a medication therapy management with her, you're like, let's call your doctor. And you call the doctor and doctor like, I just inherited this patient, and you know, her blood pressure is good. Like she's good. I don't want to mess with it, right? So I don't want to take one away and it throws off something, because we get into this thing of polypharmacy. All right. So I got quick little story for y'all. This has literally happened when I was in pharmacy school. My mom's friend would come over to the house. They would eat. I would come home from school. She wore strong perfume. It was like, I don't know, Lady Dior or something, whatever, white diamonds. I would walk in, and as soon as I walked in the house, I could smell the perfume, so I knew she was up. I come in there and talk to her. She's like, "Oh, baby, you a doctor now?" I'm like, "I'm first year pharmacy school, but yeah, I'm a doctor." She was like, "So listen, I just got this cough, and this cough just bothered me." And Bob, like, "Oh, well, did you take cough syrup? Did you do this?" And she's like, "Yeah." So I was like, "Well, did you go to the doctor?" She's like, "Yeah, I went to the doctor." So goes to the doctor. I see her again, a couple months later. I went to the doctor. He gave me this cough syrup. They had her on Tessalon pearls. They also gave her like promethazine with codeine. So they gave her cough syrup. It's like, I still have this cough. And I was like, yeah, no. A month later, come back. She's now got a steroid. That's all. So she's been added Tessalon pearls. She's been added a cough syrup with the controlled substance in it. And she's been added steroids. So for those of you who've had steroids before, it's a whole list of side effects. My pharmacy students, it's 25 different side effects. Just get ready. You're going to be asked this on rotation. Just be ready. So at this point in time, I sat down with her. I just started asking her a few questions, because we had literally learned about something known as an ACE-induced cough for patients, in particular, African-American patients. You see it a little bit more frequently with them. So I asked, I was like, "Well, do you have any medications that end in PRIL?" And she's like, "Yeah." I was like, okay. So I looked it up and I printed out some information for her. I was like, "Take this to your doctor and see what they think." They switched to blood pressure medication and the cough went away. The cough was a side effect of the blood pressure medication. And it just is not a common thing, but it was a thing that happened. And, the doc was unaware. The pharmacist everybody was unaware. I just so happened to spend the time because my mom was like, "Still, can you just sit down and talk to her? Because it's really bothering her." Yes, ma'am. I sit down and talk to her. And so, and I spent the time because I had the time as a pharmacy student, but as a pharmacist, you can pick up on these things a lot faster because you've seen them before. And so she didn't need to be on any of those other medications, which makes me wonder about how many people in this room or family members of people in this room had something happen that was actually a side effect of a medication, went to the doctor, complained about the side effect. And the first thing that the doctor thought was, "Oh, we need to give you something for that." Okay. Look, my dad is an MD. I love my MDs, okay? My MDs are trained to diagnose, okay? Come in, what's your problem, right? My PharmDs, my pharmacy students or wherever, they're gonna tell you when you get out there, think drug first. So if you come to me and say, "Man, something going on with my knee, what kind of medications you taking?" Like, what does medications have to do with knee? Like, look, this is the lens that I have. This is the way that I view things, right? So I always think medication first and see what we can do to take away. I know I'm a pharmacist and I make a living talking about drugs and knowing about drugs. I don't particularly care for drugs. I take the minimum amount of drugs as possible. And I always recommend for my patients to take the minimum amount of drugs as possible. So how many different drugs you can take at a time? There's no limit. Like I said, 27 is the number that I saw. Negative effects of prolonged use of gabapentin. Again, this is something that y'all can look up from a respectable site, but there are some neurodegenerative things that can happen with prolonged use of gabapentin. Gabapentin, when I first started, was just a medication for neurologic pain for folks with diabetes. It is now a controlled substance, and there's a limit on how much you can get because somebody somewhere along the way figured out that they could get high off of gabapentin. I know. See, this is why it's like, you like, really? So like with y'all, okay, I'm telling y'all this. I would not tell this to like some of my other people because they take that information and just go left with it. We'll just say that. But yeah, so the prolonged use of gabapentin, prolonged use of any kind of medication, y'all, can have some deleterious effects. So just, be aware of that. And like we said, keep an eye on things. I want to get to this one before we get out of here, because this is a one that is, okay, here we go. Yeah. So herbal medicines that improve memory, recommended vitamin to prevent prostate cancer, herbal supplements to improve sex drive. Does taking vitamin D and zinc help prevent prostate cancer? Okay, so who here thinks that vitamin D and zinc help prevent prostate cancer? Got one, we got two. Okay, so to my knowledge, there is no vitamin that you can take to prevent prostate cancer or cancer of any type. Okay, now who here takes a vitamin? Who takes like that one a day multivitamin, whatever? Okay, why do we take the multivitamin? Right, there we go. We don't eat the diet that we need to eat to start off with. So we supplement. That's why they're called supplements. We supplement it with a vitamin. I can tell you, when I was at home, my mama made me eat after all the 4 food groups. Y'all remember the little triangle? And yeah, she made us eat like that. When I got to college, it was pizza and more pizza and yeah, more pizza. So that's when I started taking a one a day multivitamin then because I knew it wasn't right for me. So herbal medications. I want to say that a large percentage of medications are based off of some type of plant or flower or something that already exists in nature. There's a lot of medications that we use now that were actually a side effect of a different medication. Like who here has heard of minoxidil? Yeah, I still got most of it, but minoxidil is actually a heart medication. It had a side effect of causing some extra hair growth. Just like I know everybody heard about Ozempic and all of that type of stuff, right? Those are diabetes medications that just so happen to cause a little weight loss. And then they figured out like, oh, well, if we taking doses like this, we can use it as weight loss medication. Now it's like the most popular drug on the planet. And all of these things are based off of something out there in nature. Like literally like digoxin, which we don't use a whole lot of that anymore. The plant digitalis, like you can have digitalis in your yard and it's like literally digoxin in your yard. Absolutely do not forget Viagra. So fun story. I did a rotation at the Children's Hospital in Memphis. And we had to like grind up the medications and, put in a little liquid thing for them. So, to my surprise, one day they gave me the bottles and they was like, here you go, doc. I was like, well, why do we have Viagra in a children's hospital? So not realizing that that was for pulmonary hypertension, right? So it was, again, a medication that wasn't designed. It opens up vessels is what it does. And so it just so happens that when it open up vessels, that works great for erectile dysfunction. And then another fun thing about the pharmaceutical world, all the other ones that came after Viagra, they took the base formula of Viagra, they twisted one little molecule here, one little molecule there. Oh, now it lasts 24 hours and we're going to call it Cialis. Now we got a patent on it. So when we say that the generic works as well as the original, it literally does, guys. So like, this is one of the things which you got to ask me about, but like, I like to kind of harp on. Do not spend the extra $2, $3, however many dollars on a brand name when there is a generic available. It's different in other countries, but in America, we have this thing called the Orange Book, and it's literally against the law for the medication that's the generic to not have the same base chemical in it as the brand name, okay? Now, some of you may have been like, man, I was on a brand name, doc, they switched me to generic. It just didn't work the same. I am not saying that there aren't some subtle differences in some of the other things that are put in with the medication, but the base medication, the thing that's doing the work, has to be the same legally. There are a few cases where it's not, and there's something, and you would know that up front, your doctor would let you know that, but the medications are the same. It's not like, you bought a Toyota versus a Mercedes, or, it's not that type of party. It's literally, it has to be the same. Now, we only got one more slide after this, y'all, but when your doctor provides you with a prescription to address your health issues, is there a set of questions you always ask the doctor about the prescription? I like this question. I was like, oh, yeah, no, I don't have a set of questions. Now, we just mentioned most of our docs don't have a whole lot of time. If your doctor's giving you a prescription, your doctor should be telling you why you're getting the prescription, guys. Who here is getting a prescription from their doctor and their doctor's not even telling them what it's for? Okay, it's okay. It's safe space, y'all. Safe space. That's okay. That is fine. Your doc may not have time. They might be running through a whole bunch of things and just like this, and this, and I'm gonna start you on this for that. And you just like, whoa, you ran through all of that stuff. You show up at the pharmacy and they're like, man, he gave me like 3 new drugs. I ain't really just. That's why your pharmacist is there. They got the time to spend a little bit more time and tell you about what these medications are and what these medications are for. So the going thing with pharmacists is it's the most easily accessible healthcare provider there is. There's no other healthcare provider where you can just walk right into the office and go straight to the doctor and start talking to them. You can't run in your dentist's office. You can't just go to the doctor's office. You got to make appointments and stuff. You don't have a scheduled appointment to come talk to your pharmacist. Now, I cannot guarantee you that you might not have to wait a few minutes to talk to them because they're doing something else, but you can walk right in and do it. And that's the other thing that I would recommend, guys. I know we cell phones and we call and stuff. I would walk in, get out the car, walk on in there, ask for the pharmacist, okay? Or say, I want to talk to the doctor, because we have a lot of technicians out there that's like, I'm a pharmacy is what they call themselves, a pharmacy. And legally they're not pharmacists, and they may have a lot of information, and you cannot live in a pharmacy without wonderful pharmacy technicians. I love my pharmacy technicians, but technically and legally, they're not supposed to dispense medical information, okay? So if you're getting it from your pharmacy technician, you're not getting it from the person that's actually had the training. And that's the only difference. It's just the training. We'll go in there, shake their hand, say hello, let them know who you are, okay? Because they will. They started this for a reason. Like, they didn't go into it to just be on the phone and try to do 1,000 flu shots a day and stuff like that. They did it because they care about their people. They care about their families. They care about their community, and they're finding their way to give back. And that's the way that they do it. So I've met very few pharmacists who did not care about people. There's a couple of them out there. They heard this, 4 years, 6 figures, and they was like, okay, sign me up. But that's just not the majority. The majority of them actually do care about people. And then finally, this one. Assuming pharmacists have access to the same portal medication as the physician does, as the pharmacists have a duty or professional courtesy to counsel with the patient regarding potential conflicts. 100%, absolutely. So pharmacists also take an oath of the pharmacist. This not exactly word for word is in there, but this is in there. Like, that's literally our job. And most of the time with today's technology and things like that, there's computer systems helping out that's going to flag things and be like, hey, this patient had a prescription for drug X. They were just given drug Y. They have an allergy to this. Sometimes the allergy you might have an allergy to one drug, and you might have a higher percentage of having an allergy to a new drug. And we will stop and we will tell you, be like, hey, do you have allergy to penicillin? Like, yeah. Okay. This drug, ciprofloxacin, might have some cross reactivity. So if you take it and you start feeling weird, stop taking it, and we're going to get you to the ER or do whatever we need to do. So with that, I'm going to give you my last little slide, which is empowering ourselves in our community. So as far as it comes to Alzheimer's, dementia, or old timers, we got to get to the doctor for a diagnosis, y'all. Okay. Like Dr. Trimble mentioned, it could be a ton of things, right? So when we talk about vascular, we talk about people with high blood pressure, we talk about, CHF and all these things. Like, you could be having something called TIAs, which is little baby strokes, and that could be causing you memory loss. And it could be because you do have high cholesterol. You got some kind of blockage or something like that. And there's ways to treat that. But we can't do none of these things if we don't get that diagnosis. A couple of gentlemen I was talking to earlier about prostate cancer. It's like you have to go in and get checked. And the way that you get checked is probably not going to be the most fun experience. Okay? But if you don't go in and get checked, we can't find out. When the symptoms are so bad that you find out that way, it's so much harder to treat. Case in point, I turned 45 last October, turned 46 this October. They changed the rules on colonoscopies. And it used to be 50, but they dropped it on down. And so it was a red flag when I went into my doctor for my year checkup. And she was like, yeah, it's time. I was like, no, I got 5. She's like, no, it's now. And y'all, I went, and it wasn't bad. I know many of you in this room have probably had one already. So, but when I was young and I was handing out the big old bottle of salt water, I'm like, just drink it. Like, my day is coming. My day came. It wasn't that bad. But it's preventive medicine, guys. Because remember what I said, ounce of prevention, pound of cure. Okay. So last 2 things, go into your pharmacy, talk to the pharmacist, ask them about MTM. They want to do the MTM. Their bosses want them to do the MTM. The insurance company wants to do MTM. And then finally, I need everybody to go home, go to your barbershop, go to your rec league, go to your church, go to your Bible study. I know a couple of you out here retired and y'all got some other interesting things that y'all do. And just tell them something y'all learned today. Just something. one thing, simple as you can get a free review of your medications at the pharmacy paid for by your insurance. And you need to do it at least once a year because you might be taking medicine that you don't need. Oh,
absolutely.
All right.
Thank you, Dr. Boutte. When I found out he was from Lake Charles, that he's gonna bring it. Did he bring it? We're gonna start our Q&A session, but before we do that, we'll just give some people who may not have been here before the little rules and how we conduct our Q&A. So if you have a question, raise your hand. We'll get a microphone to you. Okay? We want you to speak into the microphone because we are being recorded. We want to hear your question. The second thing, make sure that your question is in the form of a question versus a statement. This is Q&A, and so we want to utilize the doctor while he's here as much as we can, okay, for those who have pressing questions. And the third thing, if you don't know about some of the things that he was saying and you want to ask him directly, he will stay around for a few minutes to answer a few questions directly if it's something that you don't want to share as a question to the general audience, okay? So fair enough. We're going to move from right to left. And I've got Christopher over there, and he's going to come over there and bring your mic, okay?
Thank you, Dr. Boutte.
Yes, sir.
I have a question about, a lot of times we have prescriptions changed and move on to a different medication or different strength, and we no longer can use that med. How or where can you donate prescriptions, meds, for others to use?
Okay, so for everybody, if you didn't hear the question was sometimes we are on a medication and the medication will get switched. We're on something new now. We still have some of the old one left. Where can we donate that medication? Unfortunately, y'all, we can't donate it. That's the thing is that if the medication is prescribed for you, it's prescribed for you only, and you should be the only one taking it. Now, there are most pharmacies or pharmaceutical entities will have some sort of a way you can bring back medication. Sometimes they're bring back days and things like that, and for like the controlled substances. So like sometimes those pain medications, right? Real strong pain medications, your Percocets, your Lortabs and things like that. You got it for the dentist appointment. You took a couple of them, you still got some left over. You just bring them on in. Like we don't need to keep them in the cabinets and stuff like that because we got little people and things like that. And some bad things can happen that way, but there's not a way to donate the medication. I love the thought of like, hey, people that's having a hard time getting medication, I got some and I'm gonna get rid of it. There's bring back into the pharmacy places. And there's also, if you go to the pharmacy, sometimes there'll be like $3 out there. You can buy this little box with a little bag, empty the medications into the bag, put some water in it, and you ship it off type of thing. So unfortunately, we can't donate them to let other people use them, but we definitely need to get rid of the ones that we're not using because you don't want to accidentally grab the old bottle. Or like if you ask somebody to reach in there, like grab my hydrochlorothiazide, you on 50 milligrams now, but you had an old bottle of 25 in there, and now you're taking the wrong dose. If y'all like me, you might need your readers, and it's a lot easier if you only got 3 bottles. You got to look and see exactly which one it is.
And as suggested earlier, you don't want to do with them what happens when a drug raid comes to your house. You don't want to flush them down the toilet.
Absolutely not. Don't
do that. Do we have any questions on this side? Otherwise, we'll go back to the gentleman over there near the table. The other gentleman that had his hands raised right there. Okay. We got one right here. Give me just a second. What's your question?
Yes, from a generalist point of view, Doc, in dealing with supplements, what would you suggest as being in addition to the one-a-day vitamin, that'd be a good supplements to take?
So generally speaking, the way that we work, which is the reason why I plug again for research, y'all, is that the FDA approves medications based off of clinical trials. Now, with herbal medications, and this I used to tell a story all the time, with herbal medication, there's not regulating bodies. So I tell people, I could cut my grass, I could take the shavings, put it in a little capsule and call it Nate's colonic cleanse, $5.99. And if you ate some old grass shavings, you would get a colonic cleanse. But there's no FDA regulation on the herbal products. That's why they're literally herbals and supplements. So they get to kind of skirt around those rules of the Food and Drug Administration. So now there's one, glucosamine chondroitin. It goes by a lot of names, Osteoflex, Triflex, Biflex. They've done clinical trials in that. It's like for your joints and your knees and things like that. And that's one that I do know works, and one that I actually have seen clinical trial data on. Now, we do have some websites out there that I would access when I was in the pharmacy that would give you a little bit more information about the herbals. But as a general rule, I try to stay away from the herbals because we don't have the information. It's not that they don't work. Okay, because like I said, most of the pharmaceutical grade drugs are based on some type of plant-based thing that's already out there. So they can definitely work. So like some of the things like St. John's wort, for example, like it's so many drug interactions with that medication. It is, even though it's a herbal, and anybody can walk over the counter and get it, it's just a lot of interactions with it. So we always have to watch out for it. So like when we do those medication therapy management, we got your list of drugs, and then it's like, what do you take over the counter? That is so important for you to tell us the medications that you take over the counter. One of the medications that, because I'm old now, used to not be over the counter that is now called proton pump inhibitors. So like your omeprazoles and things like that you take for ulcers. The way those drugs work is they decrease the amount of acid that's available in your stomach, which means that if you're taking a medication that needs that acid to break down into work, it can actually keep that medication from working. I don't know how many of y'all are familiar with hepatitis C. But that was one of like the major things with that medication is you have to watch out. If that patient is taking it, the Hep C medication won't work. And it's $30,000 a bottle. So yeah. So it can be tough.
Thank you.
Thank you, Dr. Boutte, for your insights here. Clarification, not a question. When you talked about medication-induced cough, you use the term ACE-induced cough. Is that an acronym or ACE? What are you?
Yeah, so it is a ACE inhibitor. It's a angiotensin converting enzyme inhibitor, and that's just the way that the medication works. And it can cause a cough in some people. Pharmacy students over here looking like, please don't call on me. Please don't call on me. But yeah, no, it's a type of blood pressure medication that you can take. And actually, I think, did I say enzapril? Yeah. And it's Artens, right? The Artens are the ACE. Those Pril. Okay, all right. There are two classes of drugs that both kind of do the same thing in a slightly different way. But it can cause it. But yeah, it's angiotensin converting enzyme inhibitor.
One minute.
Thank you. Yes, sir.
Dr. Boutte, could you please elaborate on the importance of having all or most of your prescription at one pharmacy?
This is my pharmacist, right? Okay, so I didn't say this during the talk, but because I just want you to go to the pharmacy. But if at all, if you can go to the same pharmacy, most of the pharmacies today, they're linked. So like if you go to Walgreens, the other Walgreens can see what you're taking. They can see what we call your complete medication profile. What happens is sometimes you go to the doctor, your regular doctor, they send it to your regular spot, right? You have something happen. You go to the hospital, you get some prescriptions and you go and get them from the hospital pharmacy, right? Or you just go get it at whatever pharmacy was closest because you need it right away. If they give you something that's more than just like a week or something like that, we don't know that you're taking it. So like when I say like I can't answer a question without being able to pull up your profile and stuff, if I pull up your profile, but I don't have all of your medications on it, I'm not truly making an informed decision. The one sort of thing around that, which is where I'm bringing it back to that medication therapy management brown bag, is most likely if you went to another pharmacy, you still use your same insurance, right? And so when the medication therapy management happens, you're actually pulling up everything that we have an insurance claim for. So we should be able to see everything, no matter which pharmacy you got to fill that, assuming you used your insurance, because I know we got GoodRx cards and other discount cards. And, they're quick to say, well, it's $25 on your insurance, but I can get it down to $5 with the GoodRx. Now I don't have visibility on it as your pharmacist doing at MTM. So thank you very much for that point, Doc. Try to do that if you can. Yes, sir. Okay.
This is a quick one. Do pharmacies make reports to pharmaceutical companies listing the doctors that prescribe their medicines?
Try to tell me a little bit more about that. Like,
Well, I find it interesting that pharmaceutical salespeople go directly to doctors.
mhm.
And so I'm wondering if there's some type of circular dollar value in terms of them selling, him prescribing, and you filling. How does the pharmaceutical company know that?
Okay. All right.
That's a gangster question right there. You talk about the mob.
Well,
All right, Doc.
I can't speak to the gangster part of it. But what I can say is that yes, pharmaceutical companies are aware of doctors' prescribing habits, right? So like they know that if, say for example, Dr. Trimble over here, if he's got a bunch of patients that all have Alzheimer's, they know that he has a bunch of patients that all have Alzheimer's. So if they got a new Alzheimer's medication, they will show up at his office like, hey, Dr. Trimble, like you're an expert in the field and this and that, whatever. Would you like to come out to dinner and we can talk about my new medication, right? So that is part of it, right? They know, like they have that data. Now, how they get that data, I'm pretty sure that's the gangster behind the scenes curtain part of it, because I know that they have it. I don't know how they get it, but I know that they have it, okay? Because those same sales reps will come to the pharmacy and be like, hey, do you have my new drug on your shelf? Like, no, but I can order it. Well, listen, I just talked to Dr. Trimble and he said he got a couple patients he probably gonna put on it, but I want to make sure that we have it somewhere on the shelf. So, can you make sure you got some on the shelf? And so when you go to Dr. Trimble, and he writes you the prescription for it, and then he's like, you know what, the Walgreens over on 3rd should have it in stock. And you like, how do you know that they got? Because this drug representative, who's a salesperson, whose job it is to get doctors to write these prescriptions, but they don't get credit for it until it's actually sold at the pharmacy. So they do everything that they can to make sure that that happens. And now, my personal little two cents on this. I used to not be a fan of it because I was only on the pharmacy side of it. When I started to come over to the pharmaceutical side of things, I started to see the benefits of that system because, like I said, there's a brand new Alzheimer's medication out there, right? And one of the things about it is that you got to get diagnosed soon so you can get it and for it to work. Dr. Trimble, when did you graduate, Dr. Trimble? I'm calling on you. When did you graduate? No, seriously. From medical school.
But let me just say something.
Come on up. Come on.
I don't care how many. I cannot be bought. I will always do what's right for you.
Amen. Amen. Just one more question for the audience. Quick question for the audience. How many of you are it's the
Testing. Try this one.
many of you are caregivers in some sense? Caregivers. Maybe your mom, maybe your aunt, uncle, you help them and you help them out. So it's important that you all take this advocacy approach to the people that you are caring for as well, because I'm going to tell you what will happen sometimes and you won't even know about it. And the person that you're caring for won't know about it. The doctor will either write them a new script or increase their medication dosage without, it's happened to me, okay? And increase their dosage without never telling you. They just look at your chart and say, oh, okay, I see your cholesterol is high. And they'll write you another script or increase your dosage without even letting you know. So check those dosages for the people that you're caring for, and also make sure that if they're taking a new medication, consult with the pharmacist about that. That's one of the things that I have discovered recently. I've been on the same medication for 20 years, and all of a sudden, I went from the very lowest dose to, I didn't even know about it until I started doing my brown bag, and I'm going like, this is not what. So that's just a feedback. We've got time for one more question for the doctor.
First of all, this is incredible. Give us a round of applause, right? My name is Dr. Ron. This is good. That's just a change, right?
Yes, sir.
The MTM. I got my prescription from Walgreens.
Okay.
And then they switch it to CVS.
Okay.
Same medication. And I requested the MTM.
Okay.
And they told me in one instant I could. And the next one, I have no time for that. Same pharmacy. But I want to encourage every one of us. This is incredibly great. An ounce of prevention is better than a pound of cure. But if you can't do great things, do small things in a great way. Spread the message. God bless.
Thank you. All right.
It's not working either, sweetie. Chris, can I get your mic, please? Let him get a quick question in, and then I want your mic up here because I've got some.
My question is, the drug of the day that we're here advertised over the TV, CMOS. Is there a challenge with that interacting with any of the drugs that we're taking?
I'm sorry, you said the drug of the day is
CMOS.
CMOS.
Yes, everybody's advertising, take CMOS, take CMOS.
Oh, the supplement.
The
Okay.
supplement, yes.
So like I said, the supplements, the herbals, a lot of times there's not clinical trial data on it. So I can't speak to say that it will work or that it won't work. You may have a friend that takes it that say it will work. They may have somebody look like me with a little white coat on that says like this medication is effective and it's safe and so on and so forth. Well, if it was, you should have went through the FDA and got it approved that way. So that way you could actually have a prescription for it. Now, there are some other medications that are out there that like Lavazza, which is basically fish oil. Just there's medication version and there's over-the-counter type version where some of those things you can kind of slide by on, but like I'm not sure with CMOS. And when I'm not sure, then I don't recommend it to anybody. Now, if they can show me some clinical trial data and I can go through it and I'll feel better about it, then I might say maybe give it a shot. But I will go to my doctor first, let them know what my problem is, see what they recommend. Because you know what? A lot of times, and I'll close with this, the best medicine, diet and exercise, y'all.
Oh, nice, nice, nice. Good way to close. Give Dr. Boutte a big round of applause. We appreciate you so much. Thank you, thank you, thank you.